This week, we'll talk about preventable chronic diseases. We'll discuss 5 diseases in depth. We'll talk about risk factors associated with these diseases and prevention strategies. As we go through this week, I'd like you to pay special attention to the commonalities that we'll notice between risk factors among these diseases, as well as prevention strategies that are applicable to them. So we'll start off by defining what we mean by chronic diseases and identify chronic diseases that are linked with lifestyle choices and therefore can be prevented. We'll also identify key lifestyle risk factors that are often associated with chronic diseases. And again, I'd like to reiterate that as we look at specific chronic diseases, look at the commonality of key lifestyle risk factors and also prevention strategies for each one of them. We'll talk about, as we have talked about, impact of different health conditions, both on individual and on nations and globally. So chronic diseases develop over a long period of time. So risk factors that cause these chronic diseases may have been present long before the disease is diagnosed. So an individual may be exposed to risk factors that make them more prone to a disease may have taken place long before the disease shows up. So the risk factors that are associated with these preventable chronic diseases are often associated with lifestyle behaviors. So these diseases are also sometimes known as lifestyle diseases. And they often, but not always, there are other factors that are associated with causes of these diseases. But oftentimes, these diseases result from poor health behaviors, and these include, among the key behaviors that are associated with chronic diseases include smoking, physical inactivity, poor dietary choices, and we'll talk about each one of them in depth as we go on. Excess alcohol consumption is also associated with chronic disease prevalence, and other factors that are not associated with lifestyle factors such as family history, age, gender, and race, ethnicity, and other environmental factors may also cause these diseases. So overall, globally, about 63% of all deaths in the world are a result of chronic diseases. Major diseases among these that we'll be covering this week include cardiovascular disease, cancers, chronic respiratory diseases, diabetes, and also dementia. While these diseases are more prevalent in developed countries or wealthier countries, 80% of the deaths from chronic diseases do take place in low and middle income countries. And more than 1/4 of the deaths because of chronic diseases occur before the age of 60. So here, these two graphs compare the 10 main causes of diseases globally and in the US. So the bar chart here represents 10 leading causes of deaths worldwide. And what we see are ischemic heart disease, stroke, COPD, or chronic obstructive pulmonary disease are the top 3 causes of death globally. In the US, the top 3 causes are heart disease, cancer, and stroke. So as you can see, they are among the largest contributors of death and disease, both in America and globally. So the key chronic diseases that we'll be covering in this week include cardiovascular disease, hypertension, type 2 diabetes, cancer, and dementia. All these are impacted by lifestyle choices. And as you will notice, the lifestyle choices that are associated with these diseases such as physical activity, nutrition, smoking, alcohol consumption, are risk factors for many of these diseases that we have listed here.